Well, welcome back to Bay Area Focus. From reading initiatives to elderly services, Asian Health Services advocates for residents of all ages. Dong Sa and Tu Quach from Asian Health Services join me now to talk about the program Asian Health Services in the East Bay in Oakland. And thank you so much for joining me. Why don't we begin, Dong, just talking about the services and what is provided from medical services to community services for people in the Bay Area?
So Asian Health Services was founded in 1974 to provide with a dual mission of service and advocacy. And our goal is to do whatever we can to improve the health of our patients and our community members. So one of the key aspects of that is providing services in 12 different languages, because a lot of patients that we serve are recent immigrants. And also we provide care as a team approach, that we believe it takes a village to improve, maintain the health of our patients. So we have providers, doctors and nurse practitioners, as well as nurses, behavioral health specialists and case managers and nutritionists, and work with the patients and the family members to make sure that our patients' health is maintained and improved.
What's the biggest challenge? Getting the word out that you're there, so patients who don't speak English, and the language barrier, we're talking about Cantonese, Mandarin, Vietnamese, 12 different languages, can come to you and know where you are?
Oh, actually the biggest challenge is trying to meet the demand of the patients who want to come to Asian Health Services, and that's something that we're continuing to focus on, is to how do we make sure that we maintain high quality, but at the same time provide services to more patients.
And already you've enrolled approximately 6,000 people in ACA health coverage, and that includes what? Medical, dental, behavioral health care. Tu, why don't you talk about some of the community service that you're involved in?
So we have quite a lot of different community services program, and the Affordable Care Act, the ACA, was a big initiative in which we really had to tell a lot of people, mainly those who don't speak English, that there is this opportunity to enroll, to get covered. You know, in the past, as a community health center, we were able to see people who were uninsured, but over time we were really trying to get everyone insured and to have coverage. So that was a big piece. We also provide HIV, AIDS, counseling, outreach, as well as go out and do nutrition and physical activity programs, all kinds of different counseling that we provide to the community.
Are you finding that there's a bigger need in certain areas, say health or medical or behavioral or everything?
So right now, one of our big challenges in our dental clinic, that we are actually seeing a lot of dental care need, and so we're actually trying to find a place for another dental clinic.
I have to ask, so if we're talking about 6,000 patients so far, or 6,000 participants, I would imagine that that's quite a caseload right now. So are you able to take in more people, or is there that need for more funding to keep this going?
So right now we're doing what we can to see as many patients as possible, but we're seeing that the demand is much greater than what we could provide. And one of the issues that we're focusing on is that in 2010, Congress and the President has invested a significant amount of resources to community health centers throughout the country to provide services to uninsured and underserved patients. That funding cycle ends this year, so we're working very hard to make sure that additional round of funding is available for us to continue to meet the needs of our patients.
The patients Bay Area wide, specific to the East Bay, or where are they coming from?
So yeah, most of the health centers are kind of specifically more focused on a county. So our Asian Health Services focused on Alameda County, and we're seeing a lot of demand throughout the whole county for health services because a lot more patients are now insured under ACA.
And two, I know that you're very involved in the nail salons and helping that community and educating them. Tell me about some of the things you do to help some of the workers.
Just your question in terms of what the need is. Oftentimes, even though we're providing medical, dental, there are other things that really affect their health. So occupation really comes up. For nail salon workers, there's been a lot of health concerns about sort of the toxics that may be in nail care products, which aren't always labeled. So this issue really came up from patients who are, a lot of the nail salon workers are Vietnamese immigrants. So when they were coming into our clinic or when our outreach workers were going into the salons, they were hearing about these health concerns. So this really was an emerging issue for Asian Health Services. And we actually co-founded the California Healthy Nail Salon Collaborative, made up of 30 different organizations and members that work collectively to address this issue. So we push for different types of local, statewide, national policy. We do outreach and education, and we actually do research studies to look at the health impacts from these toxic chemicals.
Wow, that's great. All right, well, I thank you both for being here today, and we have some more information for our viewers. Thank you, Dong, and Tu. For more information on Asian Health Services, log on to asianhealthservices.org. That's asianhealthservices.org for more information on this program, and thank you. Coming up, an Oakland Arts Center that's building community through martial arts, dance, and much more.